Hello, everyone. Welcome back. This is the third video we do about finger stick glucometer checking. Today, I want to talk about some of the financial considerations with checking the finger stick and how they can affect you and what to do about them. Now, this is, of course, important because diabetes and the care for diabetes can be expensive. But also, if we know some tricks that I will teach you, it can become much more affordable and much easier. All right. So let's look again at our device and what exactly is the expensive part here. Now, I told you about the Accu-Chek machine, and why I chose it is because it has some of the least expensive equipment among the ones that are present on the market, and it has a good coverage usually by the insurance companies. There are some other glucometers that are still reliable and even less expensive, and I'll show you on future episodes. One of them that I would also trust is the Relion group of glucometers, which is the brand that Walmart uses. It has the least expensive test strip. So now let's talk about the expense and what part is expensive. Now, the glucometer, of course, when you get a box like the one that I showed you, the Accu-Chek Guide box, that one will be one cost at perhaps $25 or more, maybe perhaps $50. That is includes the price of the glucometer itself. That's a one-time cost because the glucometer can last at least 5 years, and it will have some lenses to start you off, some test strips to start you off, and the lancing device. The alcohol swabs are not supplied, but they are not expensive. Lancets themselves are actually not expensive. And as I said, the lancing device is included inside of the initial box. What is expensive is the test strips. The test strips are expensive because it depends on the frequency of how much you check your finger stick. So each test strip cash price can cost between $1 and $1.50 for the varies between different devices. For example, for the Accu-Chek Guide, it can be about $1 per test strip or a bit slightly less. But for some others, like the Bear Contour or the One Touch Verue and so forth, the test strips can actually be $1.50 or more per strip. And of course, if somebody is checking the finger stick, let's say 3 times a day or 4 times a day, that's 120 strips. Cash price would be very expensive to check with a machine that is not covered. So that is why if somebody doesn't have their insurance cover the test strips, in that case, and they have difficulty with affording that price, then of course the best way to do is to get a less expensive test strip, and that would be, in my opinion, the Relion glucometer. And as I said, it has decent reliability, and it's sold over the counter at Walmart. You can utilize it. And it has also the test strips, where the test strip would run about 18 cents per strip. So it's much less than the cost of strips for other devices. Now, if somebody has a Medicare, the rule of coverage for Medicare is that Medicare Part B, which is the part for the medical supplies, will cover for the test strips. Again, the test strips is most expensive part of the whole setup, and the amount that would be covered by Medicare for a patient with diabetes who checks the finger stick, who does not use insulin, they will cover up to 1 test strip per day. But if somebody has diabetes and is utilizing insulin, in that case, Medicare Part B will cover up to 3 times a day. And the advice for doctors and providers is to note in your prescription the associated diagnosis and that the patient has type 1 or type 2 diabetes and is utilizing insulin, and to ask in the comment section to the pharmacy to charge it on the Part B of Medicare. Now, how about somebody who needs to check more than 3 times per day? So 4 or 5 times or more per day. Is it easy or possible to get Medicare to apply an exception? It is not. It used to be possible to just ask Medicare to apply for an exception, relatively easy, I would say, by noting that the patient is using multiple injections of insulin per day, has fluctuating blood sugar, and so forth. But now it's become much harder to do that for a simple reason that there is a way to negate the need for that high frequency of finger stick, which is to use the continuous glucose monitoring systems. And of course, in future episodes, I'll show you some of the CGMs, how to apply them, how to utilize them. But these are some of the ideas that I hope are helpful to you regarding the financial coverage. Again, if you have any other questions or comments, please drop them in the comment section and I will address them in future videos. Thank you for your attention. You have a great day.